Anxiety and nausea, understanding the connection. Anxiety and nausea often go hand in hand, creating a distressing cycle that can significantly impact an individual's quality of life. Understanding the relationship between these two conditions is crucial for managing symptoms effectively. Here's an in-depth look at how anxiety can lead to nausea and ways to manage this common issue. Number 1. The physiology of anxiety and nausea. Anxiety triggers the body's fight or flight response, a survival mechanism that prepares you to respond to perceived threats. This response involves several physiological changes, including release of stress hormones. When you feel anxious, your body releases stress hormones like adrenaline and cortisol. These hormones prepare your body to either confront or flee from danger. Changes in blood flow. Blood flow is redirected from the digestive system to the muscles and brain to prepare for rapid action. This shift can slow down digestion and lead to gastrointestinal discomfort, including nausea. Muscle tension. Anxiety can cause the muscles, including those in the digestive tract, to tense up, which can result in stomach discomfort and nausea. Number 2. The gut-brain connection. The gut-brain axis is a complex communication network linking the central nervous system, brain, and the enteric nervous system, gut. This bidirectional communication means that emotions and psychological states can directly influence gut function. When you're anxious, this can lead to increased gut sensitivity. Anxiety can heighten the sensitivity of the gut, making it more prone to nausea and other digestive symptoms. Altered gut motility. Anxiety can disrupt normal digestive processes, leading to either slowed or accelerated gut motility. Both can result in feelings of nausea. Number 3. Psychological factors. Anxiety itself encompasses a range of psychological symptoms that can contribute to nausea. Worry and fear. Persistent worry and fear can create a constant state of tension and unease, which can manifest physically as nausea. Panic attacks. During a panic attack, intense anxiety can cause a rapid onset of symptoms, including nausea. The sudden surge of adrenaline and other stress hormones can overwhelm the digestive system. Number 4. Behavioral factors. Certain behaviors associated with anxiety can also contribute to nausea. Hyperventilation. Rapid, shallow breathing common in anxiety can lead to hyperventilation, which can cause dizziness and nausea. Diet and eating habits. Anxiety can affect appetite and eating habits, leading to poor nutrition or irregular eating patterns, both of which can contribute to gastrointestinal discomfort. Number 5. Managing anxiety-induced nausea. Understanding the connection between anxiety and nausea is the first step in managing these symptoms. Here are some strategies that can help. Stress reduction techniques. Mindfulness and meditation. Practices like mindfulness and meditation can help calm the mind and reduce anxiety, which in turn can alleviate nausea. Breathing exercises. Slow, deep breathing can help regulate the nervous system and reduce anxiety-induced nausea. Techniques such as diaphragmatic breathing can be particularly effective. Cognitive behavioral therapy, CBT. CBT is a well-established therapeutic approach for managing anxiety. It helps individuals identify and change negative thought patterns and behaviors that contribute to anxiety and its physical symptoms, including nausea. Lifestyle modifications. Regular exercise, physical activity can help reduce anxiety by releasing endorphins and improving overall well-being. Balanced diet. Eating a balanced diet and avoiding trigger foods, such as caffeine, alcohol, and high-fat foods, can help manage both anxiety and nausea. Medication. In some cases, medication may be necessary to manage anxiety and its associated symptoms. Options include anti-anxiety medications, such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines, can help reduce anxiety and its physical symptoms. Antiemetic medications, these can be used to relieve nausea directly. Herbal remedies and supplements. Some people find relief through natural remedies, though it's important to consult with a healthcare provider before starting any new supplement. Options include ginger. Known for its anti-nausea properties, ginger can be consumed in various forms, such as tea or capsules. Peppermint. Peppermint tea or oil can help soothe the stomach and reduce nausea. Number 6. When to seek professional help. While occasional anxiety and nausea are common, persistent or severe symptoms should be evaluated by a healthcare professional. This is especially important if the symptoms interfere with daily life or are accompanied by other concerning signs, such as weight loss, severe abdominal pain, or blood in the stoolie. Conclusion. Anxiety and nausea are closely linked through a combination of physiological, psychological, and behavioral factors. Understanding this connection is essential for effective management. By employing stress reduction techniques, cognitive behavioral therapy, lifestyle modifications, and, when necessary, medication, individuals can significantly reduce anxiety and its associated nausea, improving their overall quality of life. If you experience persistent or severe symptoms, it's important to seek professional help for a comprehensive evaluation and personalized treatment plan. Causes of nausea: understanding the triggers. Nausea, a queasy sensation in the stomach often preceding vomiting, can arise from a multitude of sources. It is a common symptom that can be triggered by a variety of conditions, ranging from benign to serious. Understanding the underlying causes of nausea is crucial for effective management and treatment. Here's a detailed exploration of the potential causes of nausea. Number 1. Gastrointestinal disorders. A significant number of nausea cases originate from issues within the digestive system. Gastroenteritis, often referred to as the stomach flu, this condition is caused by viral or bacterial infections leading to inflammation of the stomach and intestines, resulting in nausea, vomiting, diarrhea, and abdominal pain. Gastritis, inflammation of the stomach lining, which can be due to infections, chronic use of nonsteroidal anti-inflammatory drugs, NSAIDs, or excessive alcohol consumption. Gastroesophageal reflux disease, GERD, a chronic condition where stomach acid frequently flows back into the esophagus, causing heartburn, nausea, and regurgitation. Peptic ulcers, open sores that develop on the inner lining of the stomach or the upper part of the small intestine, often causing nausea, especially on an empty stomach. Number 2. Central nervous system disorders. The brain and central nervous system can also contribute to nausea. Migraines, severe headaches that can be accompanied by nausea, vomiting, and sensitivity to light and sound. Concussion or traumatic brain injury, head injuries can lead to symptoms including nausea, dizziness, and confusion. Increased intracranial pressure, conditions such as brain tumors or hemorrhages can increase pressure within the skull, causing nausea and vomiting. Number 3. Medications and treatments. Certain medications and medical treatments can induce nausea as a side effect. Chemotherapy and radiation therapy, common treatments for cancer that often lead to nausea and vomiting. Medications, various drugs, including antibiotics, pain relievers, like opioids, and antidepressants, can cause nausea. Anesthesia, postoperative nausea and vomiting, PONV, is a common side effect of anesthesia used during surgery. 4. Pregnancy. Nausea during pregnancy, particularly in the first trimester, is commonly known as morning sickness. Hormonal changes, rapid increases in hormones such as human chorionic gonadotropin, HCG, and estrogen are believed to trigger nausea in pregnant women. Hyperemesis gravidarum, a severe form of morning sickness that can lead to significant nausea, vomiting, weight loss, and dehydration, requiring medical intervention. Number 5. Infections. Various infections can cause nausea as a symptom. Food poisoning, consuming contaminated food can lead to nausea, vomiting, diarrhea, and abdominal cramps. Viral infections, infections such as influenza or norovirus can cause gastrointestinal symptoms, including nausea. Hepatitis, inflammation of the liver, often due to viral infection, can result in nausea, fatigue, and jaundice. Number 6. Psychological factors. Emotional and psychological conditions can play a significant role in causing nausea. Anxiety and stress, high levels of stress and anxiety can trigger nausea through the gut-brain axis, where emotional distress impacts gastrointestinal function. Panic attacks, sudden episodes of intense fear and anxiety can lead to physical symptoms such as nausea, dizziness, and rapid heartbeat. Number 7. Motion sickness and vestibular disorders. Disruptions in the inner ear and balance mechanisms can cause nausea. Motion sickness, caused by conflicting signals between the inner ear, eyes, and sensory receptors, leading to nausea when traveling by car, boat, plane, or amusement rides. Vertigo, a sensation of spinning or dizziness often caused by inner ear problems, leading to nausea and balance issues. Number 8. Diet and eating habits. Certain dietary factors and eating habits can contribute to nausea. Overeating or eating too quickly, consuming large quantities of food or eating too rapidly can overwhelm the digestive system, leading to nausea. Food intolerances and allergies, reactions to certain foods, such as lactose intolerance or gluten sensitivity, can cause gastrointestinal distress and nausea. Alcohol. Excessive alcohol consumption can irritate the stomach lining, leading to nausea and vomiting. Number 9. Metabolic and endocrine disorders. Conditions affecting metabolic processes and hormonal balance can result in nausea. Diabetes. Both high and low blood sugar levels can cause nausea. Diabetic ketoacidosis, a serious complication, can also lead to severe nausea and vomiting. Thyroid disorders. Both hyperthyroidism and hypothyroidism can cause gastrointestinal symptoms, including nausea. Adrenal insufficiency. Conditions like Addison's disease can cause symptoms such as nausea, fatigue, and abdominal pain. 10. Other causes. Various other conditions can also lead to nausea. Kidney or liver disease. Chronic conditions affecting these vital organs can result in nausea and other systemic symptoms. Heart attack. Nausea, along with chest pain, shortness of breath, and sweating, can be a sign of a heart attack. Pain. Severe pain from any source, such as injuries or medical conditions, can induce nausea. Conclusion. Nausea is a common symptom with a broad spectrum of potential causes, ranging from minor dietary issues to serious medical conditions. Understanding these causes is essential for effective treatment and management. If you experience persistent or severe nausea, it is important to seek medical advice for a thorough evaluation and appropriate treatment. By identifying and addressing the underlying cause, many individuals can find relief from nausea and improve their overall quality of life. Nausea treatment, comprehensive strategies for relief. Nausea, an uneasy sensation often felt before vomiting, can stem from various causes, including gastrointestinal issues, infections, motion sickness, medications, pregnancy, and anxiety. Effective treatment of nausea involves addressing the underlying cause and using specific remedies to alleviate the discomfort. Here's an in-depth look at various strategies to treat nausea. Number 1. Dietary adjustments. Making changes to your diet can significantly help manage nausea. Small, frequent meals. Eating smaller meals more frequently can prevent the stomach from becoming too full and reduce nausea. Bland foods. Foods such as crackers, toast, rice, and bananas are gentle on the stomach and can help soothe nausea. Ginger. Known for its anti-nausea properties, ginger can be consumed in various forms, such as ginger tea, ginger ale, ginger candies, or capsules. Hydration. Staying hydrated is crucial, especially if nausea is accompanied by vomiting. Sipping clear fluids like water, herbal teas, or electrolyte solutions can help. Avoiding trigger foods, fatty, spicy, or greasy foods can exacerbate nausea. Identifying and avoiding personal trigger foods is essential. Number 2. Behavioral and lifestyle changes. Certain habits and lifestyle adjustments can help reduce nausea. Eating slowly and chewing food thoroughly can aid digestion and reduce nausea. Resting after meals. Sitting upright for a while after eating can prevent stomach contents from rising back up into the esophagus, reducing nausea. Fresh air. Sometimes, stepping outside for fresh air can help alleviate nausea. Avoiding strong odors. Strong smells can trigger nausea. Keeping your environment free from strong odors can help. 3. Natural remedies. Natural remedies can provide relief from nausea without the side effects of medications. Peppermint. Peppermint tea or essential oil can soothe the stomach and reduce nausea. Inhaling peppermint oil or using peppermint lozenges can also be effective. Lemon. The scent of lemon or sipping lemon water can help ease nausea. Lemon essential oil can be used for aromatherapy. Number 4. Medications. For more severe or persistent nausea, medications may be necessary. Always consult a healthcare provider before starting any new medication. Antiemetics. Medications like ondansetron, promethazine, and metoclopramide are commonly prescribed to treat nausea and vomiting. Antihistamines. Over-the-counter options like dimenhydrinate, Dramamine, or meclizine can be effective for motion sickness and nausea. Proton pump inhibitors, PPIs, for nausea caused by acid reflux or gastroesophageal reflux disease, GERD. PPIs like omeprazole can be helpful. Number 5. Complementary therapies. Alternative therapies can be effective in managing nausea, particularly when used in conjunction with other treatments. Acupressure, applying pressure to specific points on the body, such as the P6 point on the wrist, can relieve nausea. Acupressure wristbands are available for this purpose. Acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body and has been shown to alleviate nausea in some cases. Aromatherapy, inhaling certain essential oils, such as peppermint or lavender, can help reduce nausea. 6. Treating underlying causes. Effective nausea treatment often involves addressing the root cause of the symptom. Motion sickness. Preventive measures include taking anti-motion sickness medications before traveling, choosing seats with the least motion, and focusing on a fixed point in the distance. Pregnancy, morning sickness, eating small, frequent meals, staying hydrated, and taking prenatal vitamins with vitamin B6 can help manage nausea during pregnancy. In severe cases, medications like doxylamine pyridoxine, Diocletius, may be prescribed. Medications. If nausea is a side effect of a medication, consult with your healthcare provider about adjusting the dosage or switching to a different medication. Number 7. Hydration and electrolyte balance. Maintaining proper hydration is crucial, especially if nausea leads to vomiting. Dehydration can worsen nausea, so it's important to sip fluids, drink small amounts of clear fluids frequently. Options include water, herbal teas, clear broths, and electrolyte solutions. Oral rehydration solutions, ORS, for more severe dehydration. ORS can help replenish lost fluids and electrolytes. 8. Psychological approaches. Since anxiety and stress can contribute to nausea, managing psychological factors can be beneficial. Cognitive behavioral therapy, CBT can help manage anxiety and stress, reducing their impact on nausea. Relaxation techniques, practices such as deep breathing, meditation, and progressive muscle relaxation can help reduce anxiety and nausea. Conclusion. Nausea can be a challenging symptom to manage, but a comprehensive approach that includes dietary adjustments, lifestyle changes, natural remedies, medications, and complementary therapies can provide significant relief. Addressing the underlying cause of nausea is crucial for long-term management. If you experience persistent or severe nausea, it's important to seek medical advice for a thorough evaluation and personalized treatment plan. Through a combination of strategies, many individuals can effectively manage nausea and improve their quality of life. Number 5. Common reasons for nausea, understanding the triggers. Nausea is a widespread and often uncomfortable symptom that can stem from various underlying causes. Here are 5 common reasons for nausea, each with its own distinct characteristics and management strategies. Number 1. Gastrointestinal issues. One of the most prevalent causes of nausea involves the digestive system. Several gastrointestinal conditions can lead to this symptom. Gastroenteritis, often referred to as the stomach flu. Gastroenteritis is caused by viral or bacterial infections that lead to inflammation of the stomach and intestines. This results in symptoms such as nausea, vomiting, diarrhea, and abdominal pain. Gastroesophageal reflux disease, GERD. GERD occurs when stomach acid frequently flows back into the esophagus, causing heartburn and nausea. Overeating, lying down after a meal, or consuming spicy and fatty foods can exacerbate GERD symptoms. Peptic ulcers, these are open sores that develop on the inner lining of the stomach or upper small intestine, often due to infection with Helicobacter pylori or long-term use of NSAIDs. Peptic ulcers can cause nausea, especially when the stomach is empty. Management tips. For gastroenteritis, staying hydrated and resting are crucial. Over-the-counter medications can help alleviate symptoms. GERD can be managed with lifestyle changes such as eating smaller meals, avoiding trigger foods, and elevating the head of the bed. Medications like antacids, H2 blockers, or proton pump inhibitors may also be necessary. Treating peptic ulcers often involves a combination of antibiotics and medications to reduce stomach acid. Number 2. Medications and treatments. Many medications and medical treatments can cause nausea as a side effect. Chemotherapy. Chemotherapy drugs used to treat cancer are notorious for causing nausea and vomiting. These drugs can irritate the stomach lining and affect the brain's nausea control centers. Causes of nausea and their management. Medications. Pain relievers, opioids and other pain medications can cause nausea, especially on an empty stomach or at high doses. Antibiotics. Some antibiotics disrupt gut bacteria balance, leading to gastrointestinal upset and nausea. Management tips. For chemotherapy-induced nausea, doctors often prescribe antiemetics. Taking medications with food can help minimize nausea. If it persists, consult a healthcare provider for alternatives or additional anti-nausea treatments. Pregnancy. Nausea during pregnancy, known as morning sickness, can be challenging. Hormonal changes, rapid increases in hormones such as HCG and estrogen, particularly in the first trimester, trigger nausea. Hyperemesis gravidarum, a severe form of morning sickness requiring medical intervention due to significant nausea, vomiting, weight loss, and dehydration. Management tips. Eating small, frequent meals and staying hydrated can help. Ginger and vitamin B6 supplements are also beneficial. In severe cases, medications like doxylamine pyridoxine, Diocletius, may be prescribed. Motion sickness and vestibular disorders. Issues with the inner ear and balance can cause nausea. Motion sickness, caused by conflicting signals between the inner ear, eyes, and sensory receptors, leading to nausea during travel. Vertigo, a sensation of spinning or dizziness, often caused by inner ear problems, leading to nausea. Management tips. Preventive measures for motion sickness include taking anti-motion sickness medications like dimenhydrinate, Dramamine, before travel, choosing seats with the least motion, and focusing on a fixed point in the distance. For vertigo, treatments may include medications, vestibular rehabilitation exercises, and, in some cases, surgical interventions. Psychological factors. Emotional and psychological conditions can contribute to nausea. Anxiety and stress. High stress and anxiety levels can trigger nausea through the gut-brain axis. Panic attacks. Sudden intense fear can lead to physical symptoms like nausea, dizziness, and rapid heartbeat. Management tips. Stress reduction techniques like deep breathing, meditation, and progressive muscle relaxation can manage anxiety-induced nausea. Cognitive behavioral therapy, CBT, can be effective for managing anxiety and reducing physical symptoms, including nausea. Conclusion. Nausea is a common symptom with a range of potential causes. Understanding these causes is crucial for effective management and treatment. If you experience persistent or severe nausea, seeking medical advice for a thorough evaluation and appropriate treatment plan is essential. Addressing the underlying cause can lead to significant relief and improved quality of life.